Good afternoon, everyone. My name is Yasmina Sisarak, and I'm your host for today's webinar. Thank you for joining us for our COVID-19 webinar series presented by the HealthMatters program in the Department of Disability and Human Development at the University of Illinois at Chicago through continued partnership with Project Search and their funding from the Ohio Developmental Disabilities Council in collaboration with Aspire Community Services in Illinois. We have added a summer webinar series to provide a space for community providers to share their experiences in maintaining services for people with intellectual and developmental disabilities during this pandemic. These webinars will be recorded and archived. You will be emailed once the webinar has been archived. During the webinar, please note your questions in the chat box, and we will ask these questions during the last 15 minutes of the webinars. We have an amazing response today for today's webinar. We have had over 800 registrants, and I see a lot of people are still joining. So welcome, everyone. So for today's presentation, where's the Outrage COVID-19 response now and moving forward? We're delighted to have Nicole Jorwic join us from the ARC of the United States. Nicole is the Senior Director of Public Policy at the ARC, a national community-based organization advocating for and serving people with intellectual and developmental disabilities and their families. This presentation will explore the federal policy in response to COVID-19 and how the disability community is challenged to meet the unique needs of people with intellectual and developmental disabilities, what is happening on the ground, and what more needs to be done will be discussed. In addition, current policy issues and issues that will continue as the pandemic evolves will be presented. Again, please ask your questions in the text box. I will try to get to all of them. Everyone is muted except for Nicole as she's presenting, and thank you again for joining us today. Nicole?
Thank you so much. Glad to be here with you today. I know folks are still logging on, so I'll do a little bit longer of an intro. My name is Nicole Jorwic. I'm with the ARC of the United States, but glad to be doing something for UIC because I'm sure I hope that there are folks on the phone who recognize me from my time in Illinois. I have a brother who has autism and receives services in Illinois, home and community-based services. So I'm a family member. I also practiced special education law for about 5 years, and then I was the CEO and president of the Institute on Public Policy for People with Disabilities in Illinois, and then I worked for the state running the Employment First program before I came to Washington, D.C., which is hard to believe was 5 years ago, and time flies, but I'm really glad to be on with you all today to talk about what has been happening in Washington, D.C., or I should say what honestly hasn't been happening in Washington, D.C. when it comes to people with disabilities and the COVID-19 pandemic. I'm going to talk about kind of what's been going on in the last couple of months, the legislative packages that have come together already, what we expect to be coming, and most importantly, what everyone can be doing to raise awareness for the very specific and important needs of people with disabilities, their families, and the workforce that support people with disabilities. Moving into my PowerPoint, I'm sure it's hard to believe, but March 11th was the day that the World Health Organization declared COVID-19 a pandemic. I remember that day very vividly because it was actually the last Hill meeting that I had that wasn't online or over the phone. And it also was the day that we had to make the really hard decision to cancel the disability policy seminar that the ARC does in partnership with several other national organizations. We knew from the very beginning that people with disabilities who may be immunocompromised or at particular risk, facing high risk for complications and the need to isolate and protect themselves. And I'm going to talk a little bit more about what that risk really means, because another part of that risk that is very real and unfortunately we're seeing play out is that people with disabilities are also at risk of ending up in institutions that are right now, in institutions or in nursing homes that are right now hotbeds for the spread of COVID-19. So what packages have passed? When I'm talking about packages, I'm talking about the legislation that has passed in Congress in response to the pandemic. So what I'm going to be talking about right now are what are considered relief packages. We are still in the relief package phase. Eventually, we're going to get to recovery. I'll talk a little bit more about that, and that's kind of maybe more of the big thinking ideas. But so far, we've been just relief, getting states, getting hospitals, getting individuals what they need in the face of the pandemic. So the first package was the Coronavirus Preparedness and Response Supplemental Appropriations Act, and that bill was just really to get funding into states for testing. The second package was the Families First Coronavirus Response Act. That also had more funding for testing, but the biggest thing to note for package 2 was that it included a 6.2% federal FMAP bump. What an FMAP bump means, I'm going to do my best to not use too many acronyms without explaining, but please add something in the chat box if I fail, because we do live in a world of alphabet soup. But an FMAP increase is for a Medicaid program. Medicaid funding, Medicaid is obviously a really important program. There's probably a lot of folks on the call who really already have an understanding of Medicaid, but for folks who don't, Medicaid is a state and federal partnership. A state government decides what they're going to invest in Medicaid services, and Medicaid services are broad. It's thought of as a healthcare program, but it's much more than a healthcare program. Medicaid is really the only game in town when it comes to funding long-term services and supports, or LTSS. Long-term services and supports can be everything from institutional care to home and community-based services, or HCBS. You're probably going to hear me say HCBS. Those are Medicaid-funded home and community-based services. Those are things like day supports, job coaching, residential services in a group home. And so all of that is funded through Medicaid. And I mentioned it's a state and federal partnership. And so the state makes that investment knowing that FMAP, or that match, is going to come from the federal government. In every state, it's over 50% is federal dollars. So that additional 6.2% in package 2 goes to states to support their Medicaid programs, which we know Medicaid programs are being greatly strapped right now in terms of just the health services, but also the long-term services and supports that I mentioned. I'm going to get a little bit more into that later, but the package 2 included that FMAP bump, that 6.2%, to hopefully stabilize the program. Package 3 was the CARES Act, or the Coronavirus Aid, Relief, and Economic Security Act. That bill passed on March 27th, and that bill included a lot of pieces that had supports for people with disabilities, although there's some tricky things that we had to work out. But unfortunately, still up until this point, it's relatively safe to say that the broad needs of the disability community have sort of been ignored. So when we talked about the title, where is the outrage? The outrage is about the fact that the needs of people with disability are not being included in the packages that have thus far become law. I'm going to talk a little bit more about the specifics in package 3. What's being called package 3.5 is the Paycheck Protection Program and Health Care Enhancement Act. And that bill had additional funding for the Paycheck Protection Program, which was part of package 3 that I'm going to talk a little bit more about. But package 3 included the Paycheck Protection Program that has assisted some organizations, including chapters of the ARC, to get funding that will be forgiven at the end of a given period if they are able to maintain their staffing. So it's short-term funding because we know that service providers, because of closed programs and because of the stress on the Medicaid program overall, are really going to have a hard time staying open. And so those PPP loans are really important. And package 3.5 provided additional funds for those loans. Wrong direction. So in the bill, in package 3, the progress that has been made mostly was in package 3, again, aside from that FMAP bump in package 2. Package 3 included funding for various important housing programs, including $15 million for Section 811, which is specifically housing for people with disabilities. It also included a $30.75 billion for education stabilization, some of which was meant to help meet the needs of students with disabilities. So this wasn't specific funding for special education, but it does require that funding has to be done in accordance with the Individuals with Disabilities Education Act, or IDEA. It's also important to note that Package 3 included a requirement that the Department of Education Secretary DeVos, give a report back to Congress in a month, which was April 27th, about whether or not there were certain waivers that needed to be provided of the IDEA or the Individuals with Disabilities Education Act. And that report was returned to Congress, and the Secretary did not suggest any specific waivers of IDEA. So that was a positive that I wanted to mention. Package 3 also included a short-term extension of the Money Follows the Person program. The Money Follows the Person program is a program that states use, including the state of Illinois has used it a great deal. And Money Follows the Person is a federal program where 100% FMAP, so 100% of federal dollars, flow into states to transition people who choose to out of more segregated settings like institutions or nursing homes. So it's a voluntary program both for states. It's also a voluntary program for individuals. So there's some misinformation, so I always want to make sure that I'm providing the most accurate information. And it's really important to note that Money Follows the Person is a voluntary program. But we know that individuals who want to move from more segregated settings into the community, that most expensive part is the transition. And so that's why that 100% FMAP is really, really important. And so that was extended through November 30th of 2020. We were pushing for a much longer extension. There had been a permanent extension that was introduced last December. Unfortunately, because of political sausage making, frankly, Money Follows the Person and spousal impoverishment, which is an important provision for the aging community, both were kicked along with what are called extenders, healthcare extenders, until November of 2020. One of our pushes as we move out of this will be for permanent funding of this program, because as I mentioned at the outset, we do have real concerns about individuals with disabilities being stuck in certain settings, and so these types of programs will be extremely important to see move forward. But Package 3 did include a short-term extension. That's really not it. Also, what Package 3 included is the economic stimulus payments that I'm sure you've heard a lot about because there's been a lot of news around them. And those are those individual payments of $1,300 for individuals, $500 for people who are declared as dependent. And that was also part of Package 3. Unfortunately, part of Package 3 also included language that was either ambiguous or inaccurate around people with disabilities having to either pay taxes, file for taxes in order to access that stimulus funding, also being unclear about who is allowed to receive those funding sources. But it's really extremely important to note that all of those things, the majority of those things, have been resolved through administrative action through the Department of Treasury and the Social Security Administration. So people with disabilities do not need to have filed taxes in order to have access to the stimulus. And also, it does not impact eligibility for Social Security or Medicaid. So individuals who are receiving either $1,300 or $500, that is considered a tax credit. It's not considered income, and so it won't impact eligibility for those programs. So there was a lot that remained to be done in order, after Package 3 passed, on the administrative side. My colleague, Bethany Lilly, who is our Director of Income Policy, led a lot of that work to make sure that those clarifications were made. The biggest thing that we have been talking about, yelling about, screaming about, negotiating about since all of this started is some designated funding or dedicated funding for those Medicaid home and community-based services. We're working on gaining bipartisan support. The different proposals that are out there would provide states additional funding. The mechanisms are a little bit different, and I'll talk a little bit about that later. But broadly, it would provide additional funds from the federal government to provide wage support and flexibilities for direct support professional staff and the home health and personal care attendant workforce. It would provide funding for states for individuals who are eligible or who are currently receiving services. So in a state like Illinois, where there is a waiting list for services, that would be really helpful for individuals to be able to receive some supports depending on what the state chooses to do for individuals who are on the waiting list. It also, there's clear language that this funding cannot supplant what states are already spending on home and community-based services. And that's really important because I talked about the fact that Medicaid is much more than a health insurance program, but the other thing that's really important to note is the what's called the institutional bias of the Medicaid program. And what institutional bias means is just that when one thing is mandatory and one thing is optional, there's an inherent bias. In the Medicaid program, institutional services, so nursing home services, services in the 7 institutions that are open in Illinois, those are mandatory, and home and community-based services are optional. And so that's why there can be a waiting list. So any of the 20,000 people who are on the waiting list in Illinois have an entitlement to an institutional service, but obviously the individuals, and my family was on that waiting list for a while, would rather wait and receive those home and community-based services. But the fact that the federal Medicaid law has some services mandatory and some services optional means that when there's cuts, the first place that cuts go, not because states don't think that home and community-based services are important, but because under the law, some are optional and some are mandatory, the first place that cuts come are home and community-based services. So we know that even with the additional 6.2 FMAP included in Package 2, and hopefully some additional funding coming to state and local governments, that home and community-based services are going to come under a microscope at a time when they are more desperately needed than ever. Again, because we know that we need to invest in home and community-based services, the individuals don't end up unnecessarily in more restrictive and segregated settings. So the HCBS funding that we're seeking will provide funds to support retention and recruitment of the workforce. In addition, we know that a lot of states have taken action at the state level to deem direct support, including Illinois, direct support professionals, personal care attendants, and home health aides as essential. But it's really important that obviously the workforce, while they're not providing medical services, they are providing essential services that can't be done from 6 feet away. And we need to make sure that they have personal protective equipment to make sure that that individuals with disabilities and aging adults that are receiving services are safe, and also that and so the HCBS grant program is one of the biggest asks, although it looks a little bit different in the House bill, the HEROES Act, that I'm going to talk about in a moment. So our asks before Package 4 was introduced, our top priority asks were funding for a Medicaid grant program, personal protective equipment, paid leave for caregivers. So Package 3 and Package 2 and Package 3 both included provisions for paid sick and paid leave funding from the government to support caregivers who might need to miss work. Unfortunately, the definitions that were used in the paid leave provisions left out, were not broad enough. And so they left out groups like myself, like a sibling who may have to miss work to care for a family member with a disability, or a grandparent who might have to miss work to care for a loved one. And so an extended definition was our ask, and economic impact payments for all people with disabilities. So those are those stimulus payments. Our biggest ask was to make sure that dependents with disabilities were also eligible for that $500. So those were our asks. And what was actually included, I'm happy to say, were in what passed the House, to be clear. So the HEROES Act is what we're considering the starting point for Package 4. I know it's confusing because there's a lot of different things, but when you hear Package 4, that's what we're working on right now. And the HEROES Act passed 2 Fridays ago, and it includes more than $3 trillion, $1 trillion to states and cities for local government and state government relief. It also includes some hazard pay for essential workers, and something that's called the HEROES Act, which is not the HEROES Act, but the HEROES Fund, excuse me. an incorrect slide. It's called the HEROES Fund, which I'll talk a little bit more about because I don't know that it will stay in whatever actually ultimately becomes law. It's a very large bill. It passed not at the end of last week, but the week before. The Senate Majority Leader, Senator McConnell from Kentucky, has indicated that the Senate won't act until after Memorial Day, and we know that that's true. The Senate is not scheduled to be back until Monday, June 1st. So, and the House is technically in session, but they have already taken action, and they did take action to pass the HEROES Act. So we're waiting on the Senate, which is the next House that needs to act. So the HEROES Act that became law, the HEROES Act will only become law when the Senate votes on it. I'm going to talk about the provisions that we're really wanting to make sure stay in, because frankly, it's an over $3 trillion package. We're hearing from the Senate side that they don't want to pass anything that's larger than $1 trillion, and so there's a lot of room in the obviously between $1 trillion and $3 trillion. And so our fight, the disability community fight, is to make sure that we keep those top priority asks in the package that ultimately becomes law. So the HEROES Act provided a global FMAP bump, and so I talked about that earlier. The FMAP bump is the match that the federal government, so it's a 6.2% bump. So if a state got 51% before, they would get 57.2% through June 30th, and that 6.2% aligns with package 2. And then effective July 1st, that FMAP bump would go up to 14%. And July 1st, June 30th, that's the fiscal year. So that's why there's the difference. It aligns it up until the end of the fiscal year, and then it jumps it up to 14%, which is a huge increase. And this would, again, hopefully help stabilize Medicaid programs. With 34 million people becoming unemployed, there's certainly going to be more individuals who are relying on Medicaid services. And so this is really important. That global or general FMAP bump is extremely important. It also includes, I talked about we were requesting an HCBS grant program. The HEROES Act, the House bill, includes an HCBS specific FMAP increase in lieu of or instead of a separate grant program. And so it does the same things. It's an additional 10% FMAP for a year, and it's available to be spent on the same things that were included in the grant program, so retention and recruitment of the workforce, supports for individuals who are eligible or currently receiving services, but the mechanism is different. And the way that the advocacy community is handling this is that we are agnostic. We don't care if it's an FMAP bump. We don't care if it's a grant program. We care that this additional dedicated funding stream for home and community-based services gets into the law. The reason I'm saying that is that because on just some kind of Washington, D.C. insider stuff is that one side of the aisle tends to be more supportive of an FMAP increase while it gives the other side of the aisle heartburn. So however they're negotiating it, we support the 10% FMAP bump at this point because that is more funding than the grant program would have been. It's really important for us that the funding gets in. And so you'll see things like dedicated HCBS funding. Right now, the mechanism for that passed in package 4 is an FMAP bump. The recovery rebates or the economic stimulus payments, it expands those to adult dependents and issues another round of payments that includes everyone this time. So I talked about how package 3, there was some ambiguity or some lack of clarity. The additional payments would include everyone. So hopefully we wouldn't have to go through that administrative red tape. And again, stimulus payments, stimulus funds will continue not to impact eligibility for means-tested programs. By means-tested programs, those are things like security and Medicaid. The paid leave provisions were expanded to the same leave purposes as paid sick days because the paid sick days legislation was broad enough from the beginning, so it expanded that again to include siblings and grandparents in paid leave provisions and protections. It provides an $850 million in child and adults with disabilities care, which is being dubbed family care funding for essential personnel, and that includes direct support professionals. So it includes an $850 million fund to provide that care, because we obviously, just like everyone else that's going through this, direct support professionals are under the same pressures to make sure that they can take care of their other responsibilities. And so this is going to be really important. It does also include the direct support professional workforce and the essential workforce for funding for hazard pay overtime, and that's included in something that's called the HEROES Fund. And I mentioned that earlier, and I said I would make a note on it, and so this is where I'm going to make a note on that. When it comes to the HEROES Fund, this is a proposal that actually first came out of the Senate. Senator Schumer, Senator Murray, and Senator Casey and others had introduced this. So it's an only Democratic Senate proposal, and then components of it were included in Package 4 in the HEROES Act. It's a little confusing because HEROES Act and HEROES Fund, but it was included in what passed the House. So it is at this point, it only has Democratic support. And so while I know that it would be a really extremely helpful thing, it's certainly something that the ARC and the disability advocacy community support. I just don't know the likelihood of the HEROES Fund making it in, but there are really important hazard pay and overtime, and those types of things can be funded through that dedicated HCBS funding. So we're not ignoring the problem. There is a solution still in the bill. It also included $100 billion of emergency rental assistance, a broad eviction moratorium. It also includes additional funding for that Section 811 supportive housing. So I said there was $15 million in Package 3. There was an additional $200 million in the HEROES Act that we hope will stay in. It also codifies the regulatory requirement that state Medicaid programs cover non-emergency medical transportation. Non-emergency medical transportation is extremely important to the provision of Medicaid home and community-based services. It was always allowed to be covered, but there had been some misunderstanding by certain states. So this makes it extremely clear in the HEROES Act that states have to cover that non-emergency medical transportation to support individuals getting out in the community, getting to their job, that sort of thing. Funding for nonprofits. So I mentioned that Package 3 had that paycheck protection, or that PPP, those PPP loans that are going to be extremely important to businesses owned by people with disabilities, disability service providers. This expanded, Package 4 would expand it because there had been some limitations. For example, there are some chapters of the ARC, not many, that are more than 500, and so those chapters weren't able to access the funds, and so that's an important update. It also, in the healthcare front, it provides a 2-month open enrollment period to allow individuals who are uninsured for whatever reason, so a lot of individuals who have lost their job, to enroll in the Affordable Care Act or ACA plan. Also, some folks know it as Obamacare. So individuals would be able to have that 2-month window to enroll in for health insurance. It eliminates cost sharing for Medicaid beneficiaries, which is something that the ARC has done for a really long time. From a rights perspective, this is just a duplicate slide, but from a rights perspective, it does require that, as I mentioned, that services provided for education must comply with the requirements of the Individuals with Disabilities Education Act, or IDEA. From a rights perspective, too, access is extremely important, and we're seeing a big issue with individuals with disabilities not having access to the hardware or software that they may need. And so it includes $1.5 billion for broadband access, because just access to the internet is an extremely important thing for individuals with disabilities and aging adults. So what's not in the bill? So as I mentioned, there were some fixes around the PPP program, but there's no additional funds. Package 3.5 did include those additional funds. There's no dedicated funding for special education, but the funding, as I said, the funding that is included for education would also be, those funds could be also used for special education. We really still need to make sure that there's a concerted kind of rights housing LTSS component, making sure that people with disabilities who end up in congregate settings or that are currently at, we're seeing across the country high infection rates. I know I saw the article in the Tribune over last week about the high infection rates in the institutions in Illinois. We really need to make sure that we're making sure that people with disabilities aren't left out of the conversation of how we're going to deal with those congregate settings. As far as timing for the Senate, Senate negotiations are already underway. I must have been very optimistic when I wrote that slide because they are not underway. Well, I shouldn't say are not. As of 9 a.m. this morning when I had some phone calls, they were still not underway. But we are hoping that once both the Senate and House are back, that will be next Monday, June 1st, that we hope that everyone on this call is making sure that your senators in particular, but all your legislators are feeling the pressure to act. There's been quotes from Senate leadership about not feeling the urgency, and so it's our job to make sure that they're feeling the urgency, specifically on our priority issues. We are expecting a vote sometime in June. It's possible this will bleed into July, but I really am hoping that's not the case, because obviously as the needs of the community continue to be overlooked, it's literally life and death that we're talking about individuals having the access to the personal protective equipment or PPE that they need. And, we really need to make sure that we are not resting on our laurels. It's certainly something that it's the reason that I don't think I've really taken a full day off since March 11th or whenever the pandemic was made, because this is obviously extremely important. The bill is large. The HEROES Act that I just outlined, package 4, it's huge. It's going to be greatly narrowed before it passes the Senate. And again, so it's extremely important to reach out to your, this is an old slide, sorry, but it's still important to reach out to your House members, thank them, remind them what matters, because eventually what the Senate passes is not going to look exactly like the HEROES Act that passed the House. And so what that means is that after the Senate takes action on whatever that's going to look like, and we're going to hope it includes all 4 of those top priority issues and then some, then it's going to have to go back to the House for a vote because it's going to look different. And then that's when it would go. So while the focus is on the Senate right now, because that's when the negotiations are, it's never a bad idea to keep reminding your House members what's important, because it is going to ultimately get back to their desk. So everything that I mentioned, packages 1, 2, 3.5, 4, those are the relief packages. It's not anticipated that after we get through package 4 that there will be a 5th relief package, although I do not have a crystal ball and I have been wrong before. But we do know that eventually they're going to turn to what are being called recovery packages. They might all have to, so everything that I've outlined, everything has had to have some relationship to COVID-19 to get funding in these pieces of legislation. And the recovery packages, we're not sure what that's going to look like. We're not sure if it's going to be that there has to be a direct relation or if there are going to be large packages. We know that both the administration and some members of Congress have made indications towards things like infrastructure. And obviously with the horrific thing that happened in Midland, Michigan last week with the dam is showing that there's a real need for infrastructure. Well, infrastructure doesn't just have to mean roads, bridges, and dams. Infrastructure can also mean infrastructure of care, infrastructure of services, and that's something that we're already having those conversations on the Hill. When you turn to what's next, you can't forget the disability community. I said to our CEO a few weeks ago that at some point right now and at some point there's going to continue to be an open checkbook from the federal government, and the disability community needs to make sure that we're first in line, because we do have waiting lists. We do have people that are getting stuck in settings that they don't want to be in. And so that's in order to change that, it's going to require a huge investment, and that's going to be more than just COVID related. And frankly, when we get the dedicated HCBS funding, that I really do feel, as long as we continue to have a steady drumbeat of making sure legislators are hearing why that's necessary, that we will get that funding. It's funding for a year. So it's additional funding for 1 year. And so then what happens to all those individuals who are getting different services or getting services for the first time have to make sure that we're thinking about that. We also know that people are getting stuck, and so Money Follows the Person. I mentioned that earlier. That's the program that gives 100% of federal dollars to states to move individuals out of congregate settings and into the community. And so permanent extension of the Money Follows the Person program, that's going to continue to be an ask for the disability and aging population. And as I mentioned, there had been a bipartisan, the Senate Finance Committee is the Senate committee that oversees Medicaid, and the Senate Finance Committee chairs are Senator Chuck Grassley, a Republican from Iowa, and Senator Ron Wyden, a Democrat from Oregon. And those two committee chairs introduced a bipartisan piece of legislation around drug pricing, but one part of it was permanent extension of the Money Follows the Person program. So that's something that we're going to continue to push for, again, because we know that people with disabilities are going to end up in settings that they shouldn't be in. And so we need to make sure that that program is permanently reauthorized so that states have funding flowing in to support individuals moving to the settings where they would choose to be served. I mentioned infrastructure. We have a bill. It's actually called the HCBS Infrastructure Incentive Act. It hasn't been introduced in the House yet, although it has been drafted. It's just that things got a little wild. We were expecting introduction at the end of March. It was introduced at the beginning of March in the Senate. But that bill would provide grant funding for states to support infrastructure and care. So it would provide grant funding, and states can choose how to spend it to support housing, employment, workforce, and so by workforce I mean direct support, professional personal care, attendant, home health, case management, and transportation. That was going back in my memory because it's been a while since I worked on the HCBS Infrastructure Incentive Act, but transportation is the last piece. And so we will continue to work on getting that funded. But really, when we're talking about all of these problems, and we're talking about, I mentioned the waiting list in Illinois, what we're talking about are big fixes. And by big, I mean expensive. We will hope that there will be a piece of legislation that really looks at the system that serves people with disabilities. And right now, that system is a Medicaid system that funds long-term services and supports, or LTSS. And right now, as I mentioned, institutional services are mandatory and home and community-based services are optional. We need to put those on equal footing. And so that would be fixing the institutional bias in Medicaid and making home and community-based services mandatory. What that would do, it would mean there could be no waiting list. There would also need to be a lot of funding attached to a bill like that to fund the infrastructure that would need to be built. Because we know that even if the federal government said we will provide our half or our 57% of funding for states, there aren't enough service providers, there isn't a big enough workforce. And so it's not just the cost of supporting individuals who might be on waiting lists, it's the cost of creating a system that can support individuals in the community. But that's going to be a really big ask. It doesn't mean that we're not going to make it. We're already having those conversations on the Hill. Look, you want to see that if you're surprised that there are people with disabilities in nursing homes, which is something that I've heard from Hill offices, that they are surprised to hear that people with disabilities live in nursing homes, then we need to fund a system where individuals with disabilities who don't have to be in a nursing home. We have to make sure that individuals have options. You can't give people a choice if there isn't equal footing. And so we really have to look at that. And it's certainly something that the ARC, fixing institutional bias in Medicaid, has been on the ARC's policy agenda for decades. And unfortunately, there's been a lot of death, a lot of illness. We know that people with disabilities are getting infected at higher rates, are unfortunately dying at higher rates. We have data from Washington, D.C., and unfortunately from Illinois and from Pennsylvania that are bearing that out, Virginia, that are bearing that out. And so then we need to say, we know that's a problem, and the fix is making sure that people are safe in their homes and community, and safety is about a lot more than just public safety. But right now, those settings, those congregate settings, are a public health issue. So I finished about 5 minutes early, I think, which is fine because I would imagine that there's some questions. This is my email address. Folks can feel free to reach out to me. I used to have a 24-hour policy. I would say it's probably been up to 48 just because of the amount of email that I'm getting, but I will certainly get back to anyone who has any questions. At this point, I will open it up for questions.
Thank you so much, Nicole. I have been noting some questions as you've been presenting. One of them is regarding paycheck protection. In my county in California, if an IHSS worker stops work due to getting COVID-19, they will lose their health insurance after about 1.5 months, since the health insurance premium is paid off their timesheet. Would pay protection address that?
That's a good question, but I just want to be really clear. So Paycheck Protection Program is not about protecting, unfortunately, it's not about protecting the employee in that case. It's about ensuring that employers don't have to let employees go. So it would not impact that situation. That situation sounds more of like an individual insurance coverage issue, and I don't believe that there's components of that bill of the HEROES Act that would cover that situation, but that individual would be able to apply for an Affordable Care Act plan if they were going to lose coverage.
Hopefully that is answering Connie's question. Feel free to put in your question and answer or a chat box. Any questions as I ask the ones that have already come through. Also, we will be sharing a PowerPoint, and we are recording this webinar as well, just to confirm that again. Nicole, will you confirm that the additions to PPP include an extension to the 8-week timeline for forgivable funds?
Sorry, can you repeat that? It cut out for a minute.
Sure. Will you confirm that the additions to PPP include an extension to the 8-week timeline for forgivable funds?
Yes, thank you. It does. It does include that, and there's actually some legislation that's working its way through the House to maybe extend it even further. And just for context for folks besides the person asking the question, it included a time period where that employers had to keep employees employed, and also B, the payback period. And because the pandemic is lasting longer than was anticipated when I believe the legislation was being drafted, that is included in package 4. Thank you.
If the next stimulus should pass, does this mean that in a state like Illinois, with the 7 institutions, would those also get an increase, or is this package only for HCBS?
ICFs, or intermediate care facilities, so those are both publicly and privately funded for individuals with IDD. The publicly funded ones would be like the 7 institutions. Those would not qualify because this is specifically funding for home and community-based services, but those providers have already had different relief that has come through or is still in the process of coming through. But this is specifically for home and community-based services. The funding would not go to the institution.
Thank you. Had another question. Did Congress make any recommendations for waivers?
I think that question is probably about waivers of the IDEA or Individuals with Disabilities Education Act or the Americans with Disabilities Act, the ADA. And at this point, there are not waivers included. That's something that we're also being vigilant around, making sure that in protecting businesses that we aren't eliminating protections of individuals with disabilities civil rights.
Another question is, do you anticipate a Senate bill passing by end of June?
I really hope so. For my own sanity, It's really hard to say, frankly. It's just because we don't really know where the conversations are. What I will say is that we know very well that it's anything that passes is not going to move as quickly as the legislation that moved in March. It's hard to believe because time really seems like a vacuum at this point, but the pandemic was called a pandemic by the World Health Organization on March 11th. Between the end of January but in March, 2 big packages passed, and they came together really quick. And then we've seen the problem with that is that we've had to do all these administrative fixes and other things like that. And so what I will say is that I'm confident that the legislation that ultimately passes the Senate and then goes back to the House and then hopefully becomes law will be much more thought out. That's my positive spin on the fact that it's probably going to take a little bit longer. But I think it's likely that we'll see something by the end of June or the first week of July.
Fingers crossed, right?
Yeah, I'm holding my breath, but that's
we have another, I think it's more of a comment, and then from Kenneth. He says, or they say, my frustration is where unemployment will adversely affect individuals with benefits of those who work. Unemployment should not count in their budget. Many have decided not to apply because of it. Can you speak on this?
I think I understand the question, so I'll answer it from what I think. But first of all, obviously, there are people with disabilities who are also losing their job, just as there are 34 million Americans that lost their job. Obviously, there are people with disabilities in that category. And I think the question is around whether or not individuals with disabilities should be applying for unemployment benefits, and the concerns around how that may or may not impact their other benefits, their other means tested benefits. And that's really going to be, that's such a state-based and individualized question that I couldn't give, advice or thoughts, but it's definitely a concern that we're hearing. And something else when we're talking about recovery or employment or unemployment, in all of those pieces, we are working really hard to ensure that there's an understanding that whether it's private corporations or whether it's the government looking at the recovery, that employment for people with disabilities can't be lost in the shuffle, because we know that a lot of people with disabilities have lost their jobs.
Another question from Patricia is, what can individuals with disabilities expect to receive economic impact payments?
So my understanding from my colleague Bethany is that people should be receiving them already. It's going to just depend on, just like the general public, just timing and luck. But they are flowing. I know that for sure that people with disabilities have been receiving their payments. So if you haven't gotten them, make sure that you check in with your local IRS office. But assuming they are flowing from the Social Security Administration.
We have a couple of questions from Connie. One is, have you found it effective for people to call relatives in other states to ask them to contact their senators to support our proposal? Are the out-of-state people we contact willing to do it?
I think that's a great idea. It's definitely something I've heard work from board members, from service providers that will call the state next door. I think it definitely does work. And I'm really, Connie, I'm glad that you asked that question, because it also reminds me that I should talk about some tools that we have for advocates. We have, if you go to the arc.org/joinourfight, you'll be directed to our Action Center. And our Action Center has an action alert to tweet your legislators, to call them, or to write them. So however you feel comfortable, that's in there, and it also includes talking points. Those talking points you can cut and paste in an email and send to someone, a coworker, a cousin, a family member in another state. It's extremely important to just kind of know the top asks, even if it's just dedicated funding for home community-based services. But again, you can pull those talking points directly from there. The ARC also has a tool where you can create your own story. It's kind of like, as folks might remember from road trips, it's a Mad Lib style where you can enter in your information, pick which issue. So it will be, the HCBS caregiver issue, caregiver issue, paid leave, or stimulus payments, and then you can write your story. And then that goes directly to your legislator. And also the ARC we can use it in our advocacy, so it's extremely helpful. But definitely reaching out to other legislators. Obviously, Kentucky is extremely important right now. Generally, when we're working on legislation, the way that it works is that we'll work with an office. Usually that office is going to be on the committee of jurisdiction. What that means is the committee that works on the issue. In Medicaid, in the House, that's the Energy and Commerce Committee. Doesn't really make sense, but that's where Medicaid is, by the title, I mean. And in the Senate, as I mentioned earlier, it's Senate Finance. And then the leaders and the leadership in those committees decide what's ultimately going to go to the leadership, which in the House, that's Speaker Pelosi and Leader McCarthy, and in the Senate, that's Leader McConnell and Leader Schumer. Right now, how it's working is not how it usually works, obviously, because of the pandemic and also just because of how things are working. And so everything right now is flowing out of the leadership offices. So Schumer and McConnell, Pelosi and McCarthy. So California, if there's California advocates, Speaker Pelosi, thanking her for including the HCBS funding in the bill, Leader McCarthy reminding him why that needs to stay in, Kentucky for Senator McConnell, and New York, just nothing can be assumed. The ARC is a nonpartisan organization. We don't have, disability issues don't see party lines. And so it's extremely important that the message is clear that these issues are what's important to the disability and to the aging community.
Thank you. We have another question from Kathleen. In New Jersey, rehabilitation providers have received extremely delayed notification concerning any continued funding since March. Will the HEROES Act provide more streamlined funding information so that planning can occur?
So the question was about funding, and so that funding would be for retainer payments, and those are payments that are not we're not ever funded through any legislation. That's funding through the waivers. The Center for Medicare and Medicaid Services, or CMS, has been approving waivers at the state level to provide things like retainer payments. And what a retainer payment means is payments to a day program that might have been closed or most likely has been closed for 2 months, because without it, those programs would most certainly close. And so while that's not technically a legislative issue, the HEROES Act would have funding for those home community-based services that states, there's a lot of flexibility that states would have about how to spend those funds. And I'm sure in a lot of states that funding would go to support service providers to keep their doors open.
Thank you. Any other questions from anyone? Please make sure you put them in the question and answer box. There have been, the questions have been pretty amazing and great. Any last sort of comments or words, Nicole, before we wrap up?
I think that, I'm really glad that there's so many folks on this call. I think if every one of you could go and talk to 5 or 10 people that don't have anything to do with the disability community about why this is important, that's really what we're going to need. I talked a lot, obviously, about the direct impact in the legislation that has to do with COVID-19. But when I'm talking about the big, huge legislative fixes that we're going to need, they're going to be expensive, and it's going to take the whole community coming together, which is not something that always happens. And it's also going to take people outside of the community understanding why this matters. The government's going to be spending a lot of money to, make sure that the country can get back onto its feet. And we have to really take a look at what that means for the community. And if getting back to normal should look a little bit different. And that is going to include it's going to include understanding and investment that all of us have the opportunity to do with our families and friends. And so I encourage everyone to make sure that you're building your circle of influence and making sure that they understand. I know that for me, the I'll leave it this way. Thanksgiving of 2016 had been complicated for a variety of reasons, and I wasn't necessarily looking forward to going home because, just as I'm sure everyone, every political spectrum is represented at the table. And what I did is I went home and I did a Medicaid tutorial about what Medicaid is, what Medicaid does, and why we should support it. And it avoided arguments, and it allowed people to understand something that they didn't usually. And so if I can be of any help, I saw a question just pop up. The PowerPoint and recording will be available. So feel free to share. And thank you all for taking an hour out of your day to learn more about this information. We need to build the outrage in order to get the change that we need for people with disabilities across the country. Thank you so much.
Thank you so much, Nicole, and thank you everyone for your attendance today. I just wanted to wrap up and give you our second information on our second webinar for next week, Protecting Ourselves, Protecting Others, What to Wear at Work and Why, aimed at community-based organizations and direct support professionals. I will be sending a registration link along with a recording of this webinar after we end this presentation. We will make the PowerPoint and the recording available, and we will email you once we archive it. We are getting a question about certificates for this webinar. We do not provide certificates, but usually people use the confirmational email of attendance as their certificates. So you should be getting those. Thank you so much, and have a great rest of the day.
Thank you, bye.
Thank you, Nicole.